First of all, welcome. Thanks for watching this presentation. Just as a little overview about what this presentation is and who it's meant for, we're going to be talking a little bit about some of the basics of Aromanticism and what that means. It doesn't assume any prior knowledge, so if that word's totally new to you, this is great. We're going to be talking a little bit about some of the issues that Aros have and Aromantic people experience in therapeutic care and how to handle those. So it's meant largely for, this presentation is meant largely for mental health care workers who either have aromantic clients or might have aromantic clients and want to be better equipped to work with them and to know some of the potential common pitfalls and how to avoid those. The reason that we're putting this together and we've decided that this is the thing we're doing is I myself am aromantic, and I've had some challenging experiences finding mental health care and finding counselors that worked for me. And I live in a fairly large, fairly LGBT friendly community, city, and even in this case, it was a challenge. So there's definitely a lack of training and a lack of awareness in mental health care settings. So we're hoping to bridge a little bit of that gap here. Oh, also, I'm Erica. I use she, her pronouns, and I'll be talking through some of this today, as well as Anyang here.
Yeah, I'm Anyang. I use she, her, or am pronouns. And I am also aromantic, and I'm coming into this also as someone who works in mental health care. And I've noticed some things during intakes and in research settings, as well as clinical settings, that could be potentially harmful to aromantic folks. And I know that it's definitely been something that's made me hesitant to ever potentially seeking out care. So it's very important for me personally, but also I think for the community as well, that there is some basic education for care providers on how to interact and care for aromantic clients. And so we'll start with a quick outline. So we'll start with some land acknowledgements and what we already gave our introductions. Then we'll go into some Aromanticism 101, so just covering the basics of what Aromanticism is, as well as some concerns that Aromantics have expressed. Then we'll also talk about amatonormativity and how this comes up in the mental health care setting, and how to care for aromatics. And we'll end with some closing statements. And as a note, sometimes we'll say arrows for aromatics, and that's just a short version of aromantics.
Mm-hmm. Yeah, I'll just do a little land acknowledgement here. So I'm coming to this presentation from the unceded territories of the Musqueam, the Squamish, and the Tsleil-Waututh. I do a land acknowledgement just as step 0.5 towards decolonization. And if you're interested in exploring these topics a little bit more, aromantic issues and the violence of colonization are deeply intertwined things, and I don't believe one can truly be undone without undoing the other as well.
Mm-hmm. And I'm currently in the Netherlands, so I'm not on any unceded territory, but I would like to just take this moment to acknowledge that the Netherlands does have a colonial past, which is still very much having an impact on the present. So I just wanted to take a moment to acknowledge that. All right, well, to start off, what is aromanticism? Aromanticism is a romantic orientation which describes someone who experiences little to no romantic attraction. While this is the most common and broadly accepted definition, people can have their own personal definitions that will vary from person to person. Eros can vary a lot, but a common unifying experience is that they have a non-normative experience of romantic and/or romantic attraction. It's important to make the distinction between aromanticism and asexuality. which refers to experiencing little to no sexual attraction. They are often conflated and used interchangeably, but Aromaticism is its own separate and distinct identity. Some aros are also asexual, but others are allosexual, meaning they do experience sexual attraction, and some others are in between. Aromanticism exists on a spectrum. Some people experience absolutely no romantic attraction at all, while others experience rare or fleeting attraction. Yet others experience romantic attraction under very specific situations. There are many aromantic identities, which we call Aromatic Spectrum or Arospec orientations. A couple of common Arospec identities are gray romantic or gray aromantic, depending on what the individual wants to emphasize, and demi-romantic. Gray romantic folks experience romantic attraction rarely, weakly, or in specific situations. Demi-romantic folks experience romantic attraction only after an emotional connection has been made. Aromantic folks experience romantic attraction and aren't on the aromatic spectrum. The main distinction between arospec and aromantic people is that arospec folks experience romantic attraction non-normatively. By non-normative here, I mean that it deviates from the expectation that romantic attraction, regardless of orientation, is just something we all experience. So even if an arospec person does experience some romantic attraction, it's still different from the way that an aromantic person experiences romantic attraction. Sometimes people identify as arospec even if they experience some romantic attraction because they feel that they cannot fully relate to the typical aromantic experience and they find it a more useful identity.
Mm-hmm. So there are a myriad of ways that people can experience attraction. I want to just talk about a few of them, just to give a sort of scope of the range of ways that people can experience attraction. Before I even dive into these terms, I also want to note that terms are useful for communication, but ultimately attraction is a blurry experience and a complicated one and a socially influenced one that won't neatly fit into any of these boxes. So a couple of types of attractions that aromantic or other people may or may not experience are sexual attraction, which is a feeling of attraction to someone's physical appearance with a sexual component, like a desire to touch somebody sexually. There's aesthetic attraction, which is an interest or desire to look at someone and appreciate their appearance, but which isn't necessarily romantic or sexual. And then there's platonic attraction, which is the desire for friendship or another close connection that isn't romantic. Quite adorably, the platonic version of a crush is called a squish, which is just a cute little fact, and one of the many, many words that have emerged within the aromantic community to describe our experiences. So a couple of other things I want to note here. One is some people experience absolutely no attraction, none of any of these kinds of attraction at all. Attraction is not an intrinsically necessary human experience, and some people will experience none. Also, these are just some types of attraction. There are countless others beyond these as well. And then diving in as well to some different types of relationships. So I want to talk a little bit about some types of relationship styles, approaches, and philosophies that are close to the aromantic community. Now, none of these are exclusive to aromantics. You can be an alloromantic person and engage in these relationships or hold this relationship philosophy. But this will give a little bit of a scope and a little bit of an idea of what the range of possibilities out there is. So the first one I want to talk about is queer platonic, which is a non-romantic relationship that rejects the common limits placed on platonic relationships in terms of their value and commitment. So the way this word comes to be and the way that I understand it is it's something that queers the platonic. It sort of blurs and breaks and moves beyond the common limit that we place on platonic relationships. So this could be something like maybe a friend that you decide to move across the country with, or somebody that you raise a pet with, or a child, or you make financial decisions together, or any of these things that Socially, we often reserve for romantic relationships, but aren't in themselves intrinsically romantic. There's also non-amory, which is a lifestyle choice or relationship style that involves no intimate partners or long-term relationships, whether those are romantic or platonic. So I think of non-amory as fitting into sort of as analogous to polyamory, where polyamory means more than 2 partners, non-amory means 0. And then there's also relationship anarchy, which is an approach to relationships built from anarchist principles. Relationship anarchists work to oppose hierarchies in and between their relationships and their relationship types. So doing that good old anarchist thing of breaking down hierarchies. So that can include hierarchies between that privilege romantic or sexual relationships over platonic ones as well. And then the last thing I want to note here is attraction doesn't have to be the basis of any of these relationships. You can enter into a queer platonic relationship without experiencing queer platonic or platonic attraction, or any of those. Similarly, an aromantic person who experiences no romantic attraction can engage in a romantic relationship as well. Attraction doesn't have to be the basis of these relationships.
While there is growing visibility for Aromanticism, there is still a lack of academic research on Aromanticism. However, thanks to the efforts of community members, we have been able to gain insight into some mental health challenges that Aros face from data gathered through internal community surveys. Out of 1,023 respondents, 71% reported experiencing suicidal thoughts, 66% felt alienated from friends and family, and 72% reported being negatively impacted by amatonormativity, which I will explain later on. Many Aros are made to feel inferior or told anti-aromantic prejudice isn't real and that they will change when they meet the right person. Invisibility, isolation, being undervalued and dehumanized, thwarted belongingness, and marginalization are all common issues that Aros face, which can have a negative impact on mental health. While Aros may wish to seek out professional help for these issues or for totally unrelated mental health needs, there are many concerns when thinking of pursuing therapy. These are some examples of concerns that have been expressed by Aros or that we have personally experienced. As a note, when I say therapists, I refer to psychiatrists, mental health nurses, clinical psychologists, mental health assistant practitioners, and generally anyone who works in mental health care and has some form of contact with clients or patients in a clinical setting. Aromatics have stated that they worry that they'll need to be responsible for educating their therapists. Coming out often requires a lecture and a lengthy explanation, which can be burdensome and time-consuming. There's also the concern that therapists will treat their aromanticism as an issue that needs to be resolved, or that their therapists will fixate on the aromaticism when it isn't what they want to focus on. Aros also worry that romance will become the end goal of therapy, potentially being forced by the therapist into pursuing a romantic relationship, and that they will be pathologized for not experiencing romantic attraction. Aros can experience loneliness, but they might be afraid to express this because the therapist might push for a romantic relationship as a solution. These kinds of practices are a form of conversion therapy, which can be very harmful. These concerns can be real barriers for aromatics to seeking out and receiving the care they need.
So I want to go over a couple of sort of key things to keep in mind when caring for aromantic clients. The first is aromanticism isn't an issue to be solved or cured. Our mental health and other issues can be connected to our aromanticism, but they are never caused by it. As Anyang was mentioning before, Aros often have some struggles with their mental health. Being aromantic can put you in quite an alienated position in society. But the solution to that is, of course, never to stop being aro. It's to work on society and solve that alienation piece. The next one is feel free to ask your client questions about their aromanticism. But remember that they're in a therapy setting or in some other settings, they're paying you for you to help them rather than to take the time to educate you. So do a bit of research on your own as well. Trust your clients. They know their own experiences and they will always have more insight into them than you. Your clients spend 24/7 with themselves. They know themselves the best. And that's especially true when it comes to their aromanticism. If a client says that they are aromantic, even if they're doing something or behaving in a way, or they've mentioned something that doesn't seem aromantic to you, they've mentioned being in a romantic relationship in the past or the present or anything along those lines, the client is still the ultimate authority on their own aromanticism. The next is don't fixate on your client's aromanticism. Let them guide how relevant or irrelevant it is to a particular situation or concern. A client just might mention it offhand and it's not really relevant to the situation at all. And they don't necessarily want to focus in or dive into that as well. Let them guide that level of importance. And that a client may express a desire to be normal or experience romance, even if that isn't what's best for them. A lot of this can be internalized and sort of emerge from ourselves and be sort of internal things that we're dealing with as well. So just be aware that that's something that can happen. So I want to go over a couple of things of what not to say. Obviously, we are all people. You can say whatever you want, but these are some things that Aro people experience and have heard that are often misguided or even hurtful. So the first is, don't worry, you'll find someone someday. It assumes that our aromanticism is temporary, that we should define ourselves by some hypothetical future instead of our current and past experiences, as well as our own personal desires and understandings of ourselves, which is, all we have to define ourselves by instead of some theoretical, hypothetical future. It also assumes that we're worried about being Aro, which is not at all the case, or at least not universally the case. I'm not at all worried about being Aro. I quite like being Aro. The next one we hear, and this can especially emerge in therapeutic settings as well, is your feelings will change as you heal, which assumes that our aromanticism is the product of illness, which isn't the case. Our aromanticism isn't something to heal. It's not something that was ever broken in the first place. Additionally, many Aros find their aromanticism to be an important part of themselves and is not something they want to lose. For me personally, I know that if I was in a situation where I was receiving care and I was told that with time and as I got better, I would stop being aromantic, that would be incredibly distressing to me. Being aromantic is incredibly important to me. And the idea that that would leave or go away is certainly not a comforting thought. The next is, at least you don't have to worry about heartbreak or relationships. First of all, this comes across as incredibly dismissive. Many Aros do experience loss in relationships, whether those relationships are platonic, familial, romantic, or otherwise. That loss can still hurt, and don't dismiss the relationships that Aros might have. It's also dismissive of the struggles of being aromantic. Being Aro isn't a simple or easy experience for a lot of people. Finding, living with, and accepting an aromantic identity can be a challenging experience in a society that isn't always particularly friendly to that. So hold space for those struggles as well. Next one we hear is, oh, I'm so sorry, which assumes that aromanticism is something to be pitied, which isn't the case. It isn't tragic, it isn't sad, we haven't lost anything, we aren't missing anything, there is nothing to be sorry for. Then the last one that we hear quite frequently is you're missing out. The idea that for Aros who don't engage in romantic relationships, that we're missing some wonderful, vital experience to the human experience, which isn't the case. People aren't missing out by being aromantic and by living in their comfort and by living in their truth. They are just experiencing their life as best they can. And then on the flip side of that, let's go over a couple of things to say that can come across as quite supportive or affirming to aromantic clients. So the first is be supportive and show that you believe in their aromanticism. So many Aros have had their aromanticism dismissed and invalidated, So ensure that you do the opposite of that. Ensure that you believe them when they say they are aro and that you support them in that. Generally, when somebody comes out as aromantic or as any other identity, a rule of thumb is to sort of match their tone. If they mention it as some big important thing, thank them for sharing that with you and hold it as a big important thing that they've felt comfortable enough to share with you. If they just mention it casually off the side, they're just treated as such. It's a casual thing to them. It's not something that you need to dive into or deal with great importance. Next is ask questions about their aromanticism. So specifically, I recommend asking questions about the client's specific experience of being aromantic. You can say something a little along the lines of, can you tell me a bit more about what being aromantic means to you? As an aromantic person doing the general work of education about all of aromanticism, especially when you're trying to receive care, is quite a lot of work to do. But talking about what you specifically experience, because there's thousands and millions of ways to be aromantic, can be quite a useful way to have that discussion as well. Make it clear that you know a bit about aromanticism and that you're willing to do some learning on your own time. You could say something along the lines of, I've done some research into aromanticism, but I'll do some more learning on my own time. Again, putting the burden of education on your clients can take away from their ability to heal and take away from the efficiency of their care. So make sure that you're willing to do that work yourself. It's also the case that, at least for me, I often feel responsible for, if I'm introducing somebody to aromanticism, and I have to explain it all for the first time, I feel responsible for how they interact with future aromantic people. And having to sort of hold that responsibility in a therapeutic setting is certainly not something people want to do, or not something that can be productive. The next is ask for explanations of words you don't understand. Aromantic communities have come up with a large number of words to talk about our experiences, but those words aren't often understood outside of our communities. So for instance, you could say something like, you mentioned wanting a zucchini, but I'm not sure what that word means. Could you explain it to me? By the way, a zucchini is a sort of pet name for a queer platonic partner in the aromantic community. Just a cute little side note there. And then the last thing isn't really something to say, but an important point nonetheless is hold space for fluidity, spectrums, and seemingly contradictory experiences. Humans are complicated and humans are messy, and not everything will neatly fit into a box, and just make sure that you're holding space for those.
Well, as I mentioned before, a majority of aromantics are negatively impacted by amatonormativity. But what is that, besides a long, complicated word? Amatonormativity refers to the assumption that a central, exclusive, amorous relationship is a universally shared goal, and that such a relationship is normative, and that it should be prioritized over other relationship types. Essentially, it's the view that a monogamous, long-term committed, romantic and sexual relationship is inherently good and necessary for everyone, and is something that everyone wants. This assumption that valuable relationships must be romantic devalues friendships and other caring relationships. Romantic relationships end up being heavily prioritized to the point that it is viewed as necessary for happiness. Such a view particularly hurts aromantics. However, this impacts everyone, even those who desire and engage in romantic relationships. For instance, aromantic folks who may not want a romantic relationship at the time might still feel pressured to get into one as soon as possible. Amatonormativity is also often intertwined with cis-heteronormativity, which can have multiple impacts. For instance, this combination can multiply marginalize aros who are non-binary. Amatonormativity shows up in many ways, including in the mental health care setting. These are a few examples from what we have noticed and from experiences that aros have shared. For instance, being partnered or married and engaging in romantic relationships are viewed as signs of healthy functioning and normal development. A lack of romantic interest or relationships may then be viewed as a sign of interpersonal dysfunction or of arrested development, immaturity in adults. A disinterest in romance may also be seen as an indicator of pathology. Therapists and care providers might believe that there's some underlying problem causing aromanticism and potentially use problematic diagnoses to target someone's aromanticism. For instance, therapists may insist that a lack of romantic attraction is due to trauma, depression, or issues with vulnerability or attachment. Therapists may also treat romance as inevitable, assuming that everyone will end up in a romantic relationship and that this is the right way to do things. Anyone who disagrees with this is potentially questioned or pathologized. Insisting that romance is natural and good can alienate arrows. A romantic relationship might even become a treatment outcome against the arrow client's wishes. This can even happen to aromantic clients, especially those who have experienced trauma and don't want to engage in romantic or sexual relationships at the moment. Being ready to pursue romance might become the purpose of healing when the client wants to focus on healing from their trauma. Other important relationships may be dismissed, and non-romantic partnerships may even be viewed as childish or unhealthy. Many arrows have expressed feeling fearful and invalidated when they encountered such situations in therapy. This can irreparably damage the therapeutic alliance and the trust in the therapist and mental health care in general. These bad experiences can deter many arrows from seeking treatment. I want to take a moment to share some statements from professionals on their experiences with aromantic and asexual clients that further emphasize the need for arrow competence care. These come from a survey conducted by the ACE and Arrow Advocacy Project. So we'll start with Holly, who states, quote, "I'm concerned about unintentionally perpetrating microaggressions, especially around assumptions that sexual and romantic attraction are normal or the default," unquote. And then we have a comment from Lisa, who says, "I'm sure I have parts of me that have bias, maybe sad that they might be missing out on experiences that bring growth and challenge and change." Her statement certainly shows her bias. She assumes that growth and change can only come from romantic experiences, which is amatonormative. This also plays into the infantilization of arrows, assuming that we're immature and childlike for not engaging in romance. Another quote from Debbie, who states, "I think that the tendency is to assume a priori that these clients are either Asperger's or schizoid." So this comment shows that is an example of how aromanticism is pathologized and how care providers could just tack a diagnosis onto it. And lastly, we have a comment from Amy, who states, "In others, I have noticed a lack of understanding, dismissiveness, or pathologizing, especially where clients are also diagnosed with autism. There are arrows who are neurodivergent, and they experience multiple discrimination in this case, in the sense of their agency and insights being taken away from them. These are all very real examples of how therapists can be amatonormative, and again, supports the need for arrow competence care."
Lastly, we want to leave you with a few sort of key take-home messages that are key points we want you to internalize and spend some time thinking about and digesting. So the first is aromanticism is not something to be fixed. Many arrows have been told that their aromanticism is a sign of depression or repression or trauma or any other thing. Or it's a sign that there's something wrong with them, potentially sociopathic or even evil. To quote Yasmin Benoit, who's a asexual and aromantic activist, when you're aromantic, they think there's something wrong with your soul. So work to unlearn that and acknowledge that that statement is absolutely false, but is an experience that aromantic people often confront.
The second key point to take away is that people can build and value any type of relationship, including none. No relationship has more inherent value than another. Non-romantic relationships are just as important as romantic ones. People have the freedom to choose what relationships are important to them, whether they be platonic, familial, romantic, sexual, or anything in between and out of the box. Eros can value and desire intimate, committed relationships. These are not inherently romantic. They can also choose to not engage in or prioritize any relationships at all and be happy with this. Just like romantic relationships are not inherently necessary for well-being, some people might find that having relationships of any kind are not necessary for their well-being. Some folks don't have an innate desire to form relationships and they are fine with that. The main point is that there are many ways to do relationships or to not do them.
And then the last thing I want to leave you with here is love of any kind should not be the basis of humanity. Aromantic people are often sort of told that it's okay because you can still have platonic relationships, or you can still feel platonic love or familial love. And all that does is it serves to further alienate people, and it serves to sort of move the goalpost and throw some people under the bus. So love of any kind, platonic, familial, anything along those lines, is not the basis of humanity. Don't pathologize, dehumanize, or villainize people who don't experience or engage with love, or don't feel it in a normative way. We are human simply because we are. Love is not a foundational piece of that for everyone, at least.
Well, to end, we will leave you with some resources. We encourage you to follow up on this webinar by doing more reading and research. We also challenge you to identify amatonormativity in your own thoughts, lives, practices, and in society. We have created a challenging amatonormativity guide, which you can follow. Amatonormativity is something that disproportionately affects Aro folks, but I would like to mention again that this is something that affects everyone, and that being mindful of these things could be useful with all clients, regardless of their identity or orientation. As a last take-home message, we ask that therapists listen to their Aro clients without questioning their identity or experiences, and to not inherently or automatically treat a lack of romantic attraction or a disinterest in romance as a problem. Well, that's it. And we want to thank you all for your time and your attention, and we hope that you've managed to learn a couple of things and that will help you interacting with Aro clients.
Awesome. Thank you so much for your time, everyone. Have a lovely day.